The topic of our group presentation is based on the concept of elimination, which was briefly mentioned in class. The following case study being presented focuses on opioid-induced constipation. Members of this group include Mary Brout, Melanie Brawley, Jim Ropp, Tara Wolf-Stanton, and Svetlana Sakharov. This presentation is based on a scenario created by our group members that is received by the patient's assigned RN during shift handoff. John Arm is a 35-year-old male married to his wife, Christy. He has been employed as an accountant for the past 10 years and self-admittedly leads a mostly sedentary lifestyle. 2 days ago, Monday, John sustained a fall from a ladder while cleaning out the gutters of his home. After his wife called Next, we are going to look at how constipation relates to the patient presented in the prior scenario. First, there are many classes of medications with elimination-related consequences. These include, but are not limited to, anticholinergics, iron supplements, and calcium channel blockers. Due to acute post-surgical use of opioid analgesics, Mr. Arm is at heightened risk for elimination issues, specifically patient priority problems. After reviewing Mr. Arm's chart, the nurse identifies 4 priority problems. First, Mr. Arm is in pain related to his injury and surgical procedure. Second, Mr. Arm is experiencing constipation related to analgesic use, consumption of multiple fast food meals, decreased fluid intake, and reduced physical activity. In addition, constipation can Initial patient teaching. The nurse works with the patient in the morning to create an effective pain management plan with his scheduled and PRN oxycodone. Afterwards, she chooses to focus her interventions and teaching on constipation. The RN found a time before lunch when the patient and his wife were available and presented them with one of the shared video tablets. The patient was agreeable to watching a 7-minute video produced by the American Chronic Pain Association. Nursing Interdisciplinary Intervention Number 1. Institute a bowel protocol. Constipation is considered a nurse-sensitive patient outcome that is preventable. Bowel protocols are standard practice means of prevention in hospitalized patients. Medication to treat constipation start with milder, less invasive options like Colace, a stool softener, and progress through fleet enemas, an osmotic laxative. As the patient has Patient teaching topic number 1, adopting a home bowel protocol. The nurse then explored why Mr. Arm had refused stool softeners for several days now. John explained that a coworker had told him that she had had loose stools that she couldn't control from taking 6 stool softeners a day after a similar surgery. He was afraid of the same thing happening to him. The RN explained that his ordered dose of 1 Colace in the Nursing Interdisciplinary Interventions Number 2, Ambulation. One advantage of open reduction and internal fixation procedure is that it allows for ambulation to begin on post-op day 1. Among other benefits, ambulation stimulates intestinal mobility and secretions, which reduces constipation. However, the nurse is aware that ambulation is very painful. To address this, she coordinates with the physical therapist. Patient teaching topic number 2. After lunch, the physical therapist enters John's room for his afternoon session. The RN agreed that this would be an ideal time as she had administered his PRN dose of oxycodone 30 minutes prior. Mr. Arm agreed to participate in his afternoon PT session as his pain remained manageable at 4 out of 10. Towards the end of the session, the RN observed John referring to a handout with pictures as he performed Nursing Interdisciplinary Intervention Number 3, Nutrition. Another approach to relieving constipation is through added dietary fiber. There are 2 types to include, soluble and insoluble. Soluble fiber draws water into the intestine, resulting in larger, softer bowel movements. Insoluble fiber increases the bulk of the stool, which stimulates movement through the intestines. Acknowledging the patient's aversion to patient teaching topic number 3. After dinner, the RN checked in on Mr. Arm during her final rounds of her shift and was relieved when Christy shared that John had finally evacuated his colon of a soft, medium-sized stool. The couple was open to the RN's final 2 teaching topics for the day. The RN mentioned that she had made a referral to the staff dietitian who planned nursing intervention, patient teaching, topic number 4. The RN approaches her final intervention and teaching topic for the day. She identifies the patient's need for increased fluid intake while hospitalized and will ensure that his cup is always within reach. In order to track the patient's intake and output, the nurse places I and O sheets where they will easily be seen by healthcare providers. For example, next to the door or by hand wash. As this concludes our presentation on opioid-induced constipation, the following slides represent the credit given to the resources used for this project. We want to thank you for listening and welcome any questions you may have.